That's a great question, and it's actually an area of significant interest to me, because I think the ultimate goal of all what we do in clinical trials is to improve patients' outcome in the real world setting where it really counts. And in several instances, there have been gaps that were identified between what we find in clinical trials and what we find in the real life situation. So in two studies that we presented here in the meeting looking at the use of hypomethylating agents, a very important finding is that we did not find a significant difference between the use of azacitidine or decitabine for older patients who are not candidates for intensive chemo. And that's important because it's one of the more common questions that I get from doctors in the community, basically, which agent should I use? However, I think people should stick to the best schedule, so that for azacitidine would be the 7 days and for decitabine would be the 5 days. What we also learned is that the median survival is around 8 months and the transfusion independence rate is around 35%. So while those are meaningful differences and improvement in patient outcomes, I think there's still a lot to be learned and a lot to be done in terms of combination therapies with the goal of prolonging the survival and improving the quality of life of patients.